Well, the coronavirus pandemic is driving Americans to drink. New research suggests alcohol consumption rose 14% during pandemic shutdowns. Joining us live now to talk about it, Dr. Craig Allen, Medical Director, Hartford Healthcare, Rushford. Dr. Allen, good morning. We appreciate your time.
Good morning, Kevin.
Doctor, were Americans already drinking more before the pandemic began? What are the numbers? What do they tell us?
Well, yeah, Americans were, and particularly concerning was the rates in women. For the last 10 years, they've gone up like 84% for having alcohol use disorders. So there's already a background of concern with people drinking alcohol, and then we get hit by this pandemic. We are expecting to see the rates go up because Hurricane Katrina that happened, 9/11, we saw rates go up. But this has lasted for 7-8 months, and we're not seeing the end of it.
Doctor, in the research you do, in the research that's out there, what is driving the increase in alcohol consumption, particularly among women, not just with this pandemic, but as you alluded to, over a period of years now?
Right. Within the pandemic, the startling rate was a 41% increase in women with heavy drinking, so binge drinking, having more than 3 drinks in a short period of time. And the stuff that is driving this, you can look at it in 3 different ways. One, women, more so than men, tend to drink to try to get rid of negative emotions and in stressful situations. Number 2, women have been disproportionately affected by this quarantine, the pandemic, the effect on child care. Women are twice as likely to lose their job. And the stress they've been bearing the weight of this. And number 3, when women do drink, they tend to develop problems much quicker than men do. It's called telescoping. And they develop the side effects, they develop addiction, they develop the physical negative symptoms. So it's very concerning.
Doctor, it's one thing to have a few cocktails and unwind on the weekend. When do we know, when can we tell ourselves or our loved ones that there's a real problem that we need to address?
Yeah. Well, Kevin, if you find yourself drinking to try to fix something or drinking not to feel something or using drinking as the go-to in difficult situations, that's a concern. But the NIAAA, which is the National Institute on Alcoholism, put out numbers. More than 7 drinks a week for women is risky drinking, more than 14 drinks a week for men, and in a short period of time, more than 3 for women, more than 4 for men. That's when you should take a step back and maybe even try to get an evaluation from a specialist or from your primary care doc.
What are things that you recommend through Rushford that people can do so they don't get to that point for women where they're having more than 7 drinks a week or for men more than 14? What can we do in our conversations, in our daily lives, so that we don't reach that tipping point where there's a problem?
Certainly being aware that it can become a problem is important, but finding other ways to relieve stress, to relieve anxiety, finding ways to be active in the community in a safe and socially responsible way, finding hobbies, helping others, those are all very gratifying things that people can do. Exercise is a tremendous avenue to explore. There really are a lot of things, but if you're not thinking about it and you're not focusing on it, then you might just say, this is just a very, very, very long snow day, but it's not. And you can get into trouble if you're leaning too heavily on alcohol.
And finally, 20 seconds, Doctor. There are some people, within each of our families, we can probably share a story where some people are just predisposed to having tendencies of alcoholism, and we have to be aware of that, right?
Absolutely. One of the biggest risk factors is having a close relative, a parent or a sibling that has had substance use problems or early childhood trauma or having a psychiatric or mental health disorder or having another chronic medical disease. Those are all things that put you at significant risk of developing a problem. You have to be extra careful.
Dr. Craig Allen, Medical Director at Hartford Healthcare, Rushford. Excellent information. Thanks for joining us. We appreciate it.
Thank you, Kevin. Appreciate it.